my name's Barbara Donachy. I'm one of the point people for Physicians for Social Responsibility Colorado Working Group. We've only been around a year and a half, and we are hoping to become a chapter, but we've been busy. My background is I have a master's degree in public health from the Colorado School of Public Health, and got out of school and almost immediately moved into climate change. So. We, as a PSR group, we have been working on things over the last year and a half. We've met with people from the Colorado Department of Public Health and Environment. We've met with the governor's staff, the former governor's staff. We've written letters to the editor. We've done op-eds. We have put together presentation materials like this one that we really welcome everybody to use. We welcome your involvement in however you want to join up with us. There's a couple sign-in sheets around, so if you are interested in getting more information from us, just write that down. We'll contact you back. We'll just give you a call back. So, and do you know where David went?
I don't, but that's okay. We can wing it a little bit until he gets here.
Yeah, we'll just wing it
How
here.
How many people in here are members of PSR? And okay, we have not. Are you familiar with the Colorado chapter?
Yeah, I'm part of it.
Okay, great.
Okay, so this is a background of PSR, a national organization of which we're part, and they've been working on climate change issues for around 10 years. Before that, worked on mostly nuclear weapons issues, nuclear proliferation, nuclear waste. So we also have that here in Colorado. So that's on your check-in if you're interested in that. I'm going to turn it over to David.
Sorry, I had to take a call last minute. Thanks all for being here. We're obviously speaking on behalf of the working group PSR Colorado. My background is that I got involved in this about 3 years ago when I myself received a letter about leasing mineral rights. And then one of the nurses whom I work with asked me to review the CDPHE study review that basically said that it was totally safe to frack in the backyard. And so I started looking, and as a good scientist should do, is read the citations and start studying the citations of what they're telling you is true. And what I quickly realized is that none of their citations say it's safe, and most of their citations at best say that there's insufficient data to say that it's not harmful. There's a big difference between that and safety. So I've worked alongside anybody who will let me talk to them and try to educate them about all of this and try to raise awareness. I don't have any disclosures or any kind of political or financial incentives behind all of this. I'm just a concerned physician. So these are the terms obviously most people here know: PSR, CDPHE, the COGCC, what a VOC is, the volatile organic chemical. Things again that you never knew that you'd have to know, but now you do. So key points for literary criticism, of course, is that it's really easy to poke holes in scientific studies. Really easy. Everybody from day one of residency is taught how to critique somebody's research, and it's really easy to say how wrong they are in so many different ways. What's hard to do is take data and compile it into something that's useful and actually meaningful. And that's where you start getting numerous studies. So if the one study maybe has some flaws in it, and then another study which has a similar message but also has some flaws, and then 300 more or 400 more of those studies, similar message, some flaws. You start taking that similar message and looking at what that means. And that's a trending. That's something you do in these meta-analyses. You do systematic reviews. And that's really the best kind of data you're going to get when it comes to exposing people to potentially toxic and harmful chemicals. I can go off on a soapbox on that, but if you think about it like this, you're never going to get a double-blinded, placebo-controlled, randomized study when it comes to exposure of oil and gas operations on people's health. Because what that would imply is that it goes through an internal review board, that they get consent from people, and that those people are consented to the potential that they're going to be exposed to benzene, methylbenzene, and toluene, and the potential risks associated with those things. I wouldn't sign that consent form. I wouldn't let any of my family sign that consent form. And so it's kind of like, would you expose a pregnant mom to benzene? I feel like when we get into scientific data, this is what it boils down to. We're in this pod, and we know the problem, we know what the issue is, and you get two ways of saying the same thing, but that's a dissenting opinion. And so you don't have consensus. And that's kind of what it boils down to a lot of times when we get into these discussions, especially when you get into discussions with industry folks in the room. Because now all of a sudden it becomes, well, you didn't talk about this, and you didn't talk about this, and you didn't talk about... It's like all of those articles funded by industry. These articles funded by people from the National Institute of Health, and real scientists, peer-reviewed studies, things that have actually been done without financial interests in mind. Doctors aren't allowed to take anything more than a $20 gift or whatever it is from people. They're not even allowed to take pens anymore. And the reason for that is because it biases your opinion. And they've proven that it biases your opinion. And they have a Sunshine Act. That's a federal act that prohibits me from taking anything of value from a rep. And that's because they know it biases your opinion. And yet politicians are allowed to take $40 million for a campaign because it doesn't bias their opinion. This is where the social inequity kind of comes in. Why are we concerned? I mean, we had 2 great talks this morning about why we're concerned. You have Beth, who's a scientist, a mom, and she can't separate the two. And she's concerned. She can't figure this out. You need a PhD and you still can't figure it out. And I mean, really, that says something. I'm just a stupid MD. I don't know anything about the chemicals and VOCs. I was never taught anything about this stuff in med school. This all came flooding down on me in the past few years when I started reading and realizing I was way out of my league. And I started just focusing on what I know, which is health. So looking at these dangerous unknowns, we don't know what we don't know. Again, it's one of the most unregulated industries on the planet, where they are not mandated to report what comes out of the ground. They give a list of chemicals that they're putting in as part of their best management practices. They don't give a list of anything that's coming out, and they don't give a full list of their chemicals that they're putting in. So, my argument here is that the hydraulic fracturing is largely exempted from regulation. And this has been progressing since the 1970s, where every piece of legislation that's come out with very fancy names, Clean Air Act, Clean Water Act, these make you seem like they're protecting you. But in fact, what they're doing is they're actually releasing the exemptions from the oil and gas industry, and they're making it so they're less regulated, not more regulated, as part of every one of these policies. In 2005, there was more revisions of the Energy Policy Act. A couple of weeks ago, our state Supreme Court overturned a very simple request from citizens to put their health and safety above profit. That is not a crazy concept. Life, liberty, pursuit of happiness, health, not cancer. So in November, 2,500 foot setbacks were overturned. Not by a ton, but by enough. And then in 2016, the state Supreme Court in Colorado struck down fracking bans in Fort Collins and in Longmont. And the permits went through the roof. So real quick, this is just what VOCs are. There's all sorts of different subcategorizations for the chemists in the room, but it's basically what we're going to focus on is benzene. Just because it's one out of like a couple of dozen VOCs that get released, and it's an easy one to wrap your head around and has a lot of data around it. Benzene causes cancer. There's no argument about that. The American Cancer Society website, which I have a link to up here, says that benzene is known to cause cancer. It's largely focused on leukemia and other cancerous blood cells. And so bone marrow suppression, acute lymphocytic and acute myeloid leukemia. Now, unfortunately, these are not the most, fortunately, I guess, these are not the most common kinds of cancers. I'm a gastroenterologist. I work with the second leading cause of cancer death in the US, colon cancer. We still can't get people to get colonoscopies done. So AML, it's hard to get data on because it's like, you get a couple of thousand cases a year throughout the entire country. So trying to get a couple of thousand cases in Weld County is not yet there. Maybe in 10 years, but not right now. Childhood leukemia is probably one of the biggest things that got me involved in all of this to begin with, and the increased risks of childhood leukemia. So think about benzene a little bit more. So the International Agency for Research on Cancer, which is a subdivision of the World Health Organization, they also classify benzene as carcinogenic to humans, based on sufficient evidence that benzene causes AML. They also note that it's linked to ALL, CLL, multiple myeloma, non-Hodgkin's lymphoma, blood cancers, anything in the blood myelosuppression. The EPA classifies benzene as a carcinogen based on the IRIS database. So what else does benzene do for clinicians? Short term, somebody comes in with acute exposure to benzene or toluene, xylene, whatever. They may have dizziness, lightheadedness, nervous system like confusion. They may have nausea, vomiting, they may have bloody bowel movements. They may have palpitations or tachycardia. They may come in with a rash, little blisters, almost looks like it might be eczema, things like that. These, again, nosebleeds, that's the other big one. I forgot to put that up here. Long-term, causes bone marrow suppression. Long-term exposure, God knows what that means, but long-term exposure to benzene. It causes anemia, leukopenia, thrombocytopenia, ultimately bone marrow suppression, which is why they link this to leukemias, lymphomas, and all that stuff. Reproductive effects. There's been studies linking this to ovarian shrinkage and fertility problems. Is benzene regulated? Yes, for everybody but oil and gas. So benzene, OSHA, EPA, and FDA all regulate the amount of benzene that's allowed to be in the air and in the water. Those do not apply to fracking operations. We don't know why. But typically speaking, they're looking at about a 5 parts per million in a 15-minute period, or 1 part per million on an average workday. Now, I don't know if anybody's ever had to deal with OSHA on a non-compliance issue. They're a pain in the ass, and they look at every little thing. And yet somehow this industry gets away from OSHA regulating that. I don't know how they did it. We can't even have CO2 canisters.
The 2005 energy policy act.
Oh, there we go.
Loophole, so that's how they.
Was that one of the loopholes from that one?
Yes.
There we go.
Yeah.
There we go. Yeah.
Well, they were exempt from half the stuff before.
Right.
Sorry.
So water sampling and air sampling and all that kind of stuff is just exempt. And they have a gag rule for their employees, so you're not allowed to do studies on their employees, and they're not allowed to participate in any kind of trials while they're employees. So it makes it a little bit harder to investigate. This is a long list. This is looking at air quality samples from somewhere in Texas, where they have a heavy oil and gas concentration as well. Just looking at the mean sampling from this study, and this was done, gosh, these were over what, 24-hour samples, and the mean concentrations for things like benzene was about 5 parts per billion, which is already out of compliance with what we saw in OSHA standards. And this is just the air quality around the sites. And I think this was within a kilometer from the site. So this is the stuff I do know. So the PSR Companion, if you're not familiar with this, it's an excellent study. I would highly recommend going through, reading it. It gives you a great background as to where we've been, where we're going, and it's a living document, so it continues to evolve as the science continues to catch up. I will also mention that the CDPHE review that got me involved, aside from the fact that they selectively chose the data they wanted to include, it also didn't include any of the data that's come out since 2016, which is a lot. It's original research, it's scientific, it's peer-reviewed, it's probably about the best quality data that you can get in this scenario without violating the Geneva Convention, I suppose. You can't, like I said, you can't unwillingly expose people to carcinogens that you know are carcinogens without their consent. I always say that if a drug company practiced the same way an oil and gas company practices, there'd never be a drug recall, there'd never be a black box warning, there'd never be any issues. They have to go through 3 stages of FDA trials before they're allowed to put a drug on the market. I've been involved in these, and they are, again, a giant pain in the butt. They have a lot of regulation, a lot of oversight, a lot of compliance that you have to keep in line with. And if there's any little suggestion of harm, you got to pull it. You got to stop it, because the intent is not to do harm. And yet we have thousands of reviews, thousands of articles that continue to come out that are from amazing researchers from amazing institutions that are, continually discredited by people who are good at discrediting sources. So real quick, leukemia, about 6,000 cases of ALL per year. About 25% of people who develop it die from it. Most of the people who develop it are kids. Most of the people who die from it are adults. So out of the 25% of the people who actually get it are adults, and the largest proportion of the deaths are from that 25%. This was from McKinsey studies that ultimately demonstrated a 4.3-fold increased risk in leukemia in those folks living in the higher risk zones, within 0.9 mile span of the wells and drilling. That's a pretty alarming number. Now there's some contest to the validity of some of that data in terms of the confidence interval, crossing 1 and all that kind of stuff. What it does show is a trending towards harm. it's enough to get a drug pulled from the market. And that's what I kind of base my decisions on it on. So if it would pull a drug from my armamentarium, it should pull an oil and gas well from my backyard. That's just some graphing. Low birth weight complications is a very significant issue with those living close to oil and gas operations. Essentially, low birth weight is associated with almost every fetal malformation, every fetal mortality case that you get. It is listed group of complications: congenital heart defects, physical deformities, neural tube defects, neurodevelopmental disease, and asthma. That's a big deal. They found that, this is in the McKenzie study, this was from 96 to 2009. They found an increase in the number of congenital heart defects and neural tube defects and trending towards low birth weight. But then another study down in Pennsylvania, which has been exposed to this longer than we have, of a 1.1 million births over almost a 10-year time frame, showed a 25% increased risk for low birth weight infants in those living closest to these operations. They did try to correct for other factors, like saying mom in different scenarios and all that kind of stuff. And this is a pretty good quality study overall. Just to put it in perspective, almost 30,000 births in the US per year are within a kilometer of an oil and gas operation. So if you have 25% of those low birth weight, that's a pretty significant number of kids. Asthma. So asthma is probably the most one of the most serious and one of the most life-threatening things that can occur aside from cancer, in that people with asthma or COPD or emphysema or advanced lung disease, especially those living in altitude, Denver, are more prone to having asthma exacerbations based on any stimulus. If you live near a highway, it can knock off your pulmonary drive and it can make you go into decompensation. I mean, doing internal medicine residency, intensive care unit, all that kind of stuff, we've seen way too many people die of COPD exacerbations. It's not pretty. But if you just look at the sheer numbers of people who are affected by asthma in this country alone. 10 Americans die every day. 3,600 people died. This was from 2015, I think. The financial burden is huge. We spend about $56 billion in the U.S. alone on asthma treatments, and that's 50 billion of that is the direct costs. That's the hospital visits and the medications and all that stuff. Another $6 billion is the indirect costs, like missed days of work and school, and just looking at this data, it's pretty impressive. We pay about $3,200 a piece from our taxes every year to fund asthma. So if you don't think you're paying for it, you are. And then what we found is that there is a social disparity in people who have asthma versus not. And people who make less than $75,000 a year are a lot more likely to suffer from asthma and asthma complications than those who make more. I think we could take your oil and gas well and superimpose the finances, the amount of asthma, and the amount of oil and gas wells, and just put it right on top of each other, and you'll see that's where it's kind of terrible. So real quick, this is a great paper. I'll leave you with this because I'm out of time. But the gasping for breath, this is a great review from the Clean Air Task Force and also from the American Lung Association. This was published, I think, in 2017, somewhere around there. I think it was 2017. This was amazing, because even before the fracking boom in Colorado, Colorado was one of the worst air qualities in the country. And we can only assume that's getting worse. We'll see what the next rendition of this comes down with. But every air quality study I've seen so far kind of indicates that we're in trouble. Of course, air quality is directly associated with asthma risk and all that kind of stuff. And that's where they're coming from with this. I'll leave it with that. This link was going to be on the website when they upload the presentation, so you can have access to that. I've only given you about 500 pages of stuff to read throughout this talk, so.
Yeah.
So do we have time for questions or no?
So the keynote starts at 11:45.
Okay.
Now, this is your opportunity to take a bathroom break or riddle David with questions. But just to make sure that we're back in and
Or
ready
follow me to
for,
the bathroom and then we'll
for
leave.
I'll let you guys work that out. But I hope to see you guys all in the ballroom soon. And thank you, David, for letting me
Of
come.
course.
Flash.
Thank you all. Sorry we're running late. It's Dan's fault.